Hello, good morning. I am Dr. Mrinal Kanti Das. I am the past president of Cardiological Society of India. In this very auspicious program, that is CSI NIC Meet 2022, I had the deliberation on left main intervention in high-risk patients for bleeding. Now, as you know that left main is a very, very important artery which supplies almost more than 70% of our heart. So if it is blocked or if it is narrowed, then there can be catastrophe. And similar is the picture with the interventions. There could be interventions in the form of PTCA or stenting or coronary artery bypass surgery. And in case of coronary artery bypass surgery, it will be very risky if they undertake the operation in high risk bleeding patients. That is why in this group of patients, possibly the intervention with the stenting will be more judicious. But at the same time, there are chances that with high risk patient of thrombosis in left main interventions, if associated with high bleeding risk, then it's a double whammy sort of condition, and there the balancing act will have to be adopted in the tune of how much stronger antiplatelet agents you will be continuing and how long you will be continuing and what are the agents you will be continuing. So these sort of questions and answers will have to be given, and I gave that. And my final point or comment is that it's a balancing act between the high risk thrombosis versus the high risk of bleeding, and shorter duration of DAPT or dual antiplatelet therapy is to be adopted in case of high risk bleeding patients, that is for 1 month. And if the chance of bleeding is less later on, then you can continue it up to 3 months, but not beyond 3 months. After that, one should continue with the single antiplatelet agent, or if the patient is on oral anticoagulation, then the oral anticoagulation will have to be continued, and it should be continued beyond 1 year or so if the patient is indicated for oral anticoagulation. So ultimately, it is the balancing act again which is very, very important in managing the patients of left main intervention with high bleeding risk. Thank you.